And now, coming to you live in your bathroom, in your bedroom, in your lounge, in your kitchen, at home, it's Lockdown Radio.
Don't touch that dial.
Give me a beat.
That's funky.
Right, a few days into lockdown, we're more than halfway there. Let's hope. I'm sure that a lot of us are feeling a little bit anxious and a little bit frustrated and stuff like that. And we don't realize that this is the time in our life that we actually need to really look at ourselves and look after ourselves. Because when this ends, we've got to go back to the real world and we've got to be functional in the real world. So I got hold of a clinical psychologist, Michelle Baker. She's got a master's degree in psychology and clinical technology, neurophysiology, and is currently busy with a doctorate at Wits researching insomnia. Okay, Michelle has a very special interest in neuropsychology and sleep disorders as well. Joining me now on the line is Michelle Baker. Hey, Michelle, and welcome to Lockdown Radio.
Morning, Noel. It's a privilege and a pleasure to do so. Thank you for the invitation.
Only a pleasure. I assume that you've continued to work during the lockdown because people's problems just don't go away. They're still very much there, even though it's lockdown.
Yeah, Noel, you'd be right on that one. We do continue working because we're considered part of essential services, caring for people with mental health disorders. And more than that, just caring for people who find that where they were really quite calm and, felt in control of their lives are now finding that, they feel anxious, or as cabin fever starts to set in, they might start feeling a little bit down. And we are right alongside people to be able to support them and give them the help that they need, with just some simple aspects of encouragement and work. But at the same time, we also are busy with clients who have been doing work. And part of the work in psychology has to do with what we call a process, where we start work with people and they really need to be kept in that process. We can't just suddenly stop because they would feel abandoned and perhaps rejected by us. We have to, keep the work going, and it's very important to us that we do.
Absolutely. Now, psychology, is a very broad subject, and you specialize in sleep therapy and insomnia. How important is sleep during this time of lockdown?
Yes, most definitely, Noel. For me, that is my great passion. I've been working in sleep disorders for many, many years, and currently busy with some work for research on insomnia. And, this certainly is, I think, one of the most important points of discussion for us, because what people don't realize is that the minute they mess with sleep, they actually have a knock-on effect with many other aspects of their life, certainly from a physiological point of view, and certainly from a mental point of view as well. So just from a physiological point of view, we normally, with an 8 to 5 work day, for most people are going to bed between about 9 and 10, and they're waking up again around about 6. So that's what we would call the normal sleep phase. And sort of the idea would be to be getting about 7.5 to 8 hours of sleep. But having said that, there are certainly a group of people who actually are what we call short sleepers, a very small percentage of the population. And a short sleeper would really be needing about 5 to 6 hours. And then you get the other group on the other end of the scale who are long sleepers, and they sometimes need about 9 to 10 hours sleep. That's a really tough one, even on in daily living. If you're a long sleeper, it becomes quite hard, and many of these people in our very busy, time-urgent world are quite sleep deprived.
What do you call someone who sleeps 2 hours? I call them broadcasters.
2 hours sleep for broadcasters, that is pretty hectic, Noel. That's definitely You're never going to survive on that. So you probably find you're doing some naps in between and catching up, right?
Yeah, I've been known to sleep on the job. What type of impact could this lockdown have on sleeping patterns? And, just do you think it is disruptive? What sort of impact is it having on us?
The reality is, in normal daily living, where we are all busy, many of us are cutting our sleep short on a daily basis. So an example would be that many people get up quite early to go to gym, and that's a good thing too. So factoring it into being able to still get enough sleep also becomes quite hard to manage. So many people are then going to bed quite early, sort of 8:30ish, and getting up at 4:30, 5. And that would be their normal phase. But what happens during holidays, and certainly lockdown would be a form of just being allowed to let your sleep, do what it wants to. And that would be a good thing if people were still going to bed round about that sort of 9, 10 o'clock slot and are allowing themselves to just sleep through until they wake up without an alarm. But I think what happens generally is people tend to stay up very, very late. That's a more common one, to stay up very, very late, and they, on social media, watching movies, playing games, chatting to friends, and sometimes when I say late, I mean push it to about 2, 3 in the morning, and then eventually will fall asleep at about 2:30, 3, and they'll sleep through into perhaps even midday the next day. So, if you do that 1 or 2 nights, you'll be okay. And I think many people can attest to the fact that they have also done that at times, when they were at varsity or when they were pushing all-nighters, for people who are working with companies that pretty much run 24/7. But the problem lies in doing that every night, because what will happen is you start pushing that phase forward, and then your body will actually start to change its circadian rhythm, and you then develop a problem called phase delay syndrome. So just as a starting point, just to encourage people around sleep is just simply try and keep your normal phase of sleep. Don't change your sleep habits. Sleep extension can most certainly start insomnia. In other words, sleeping too long. And the big message is don't give yourself a huge amount of opportunity to sleep without actually sleeping. So if you're in bed awake a lot of the time, you're giving yourself opportunity to sleep, you are also affecting your sleep quality and quantity. So, just the message to people is please look after your sleep. It's very precious. It's very, very fragile. Doesn't like to be noticed. It's instinctual. And it likes to do its own thing. The minute you start forcing it to do something that suits you more, you will notice that you will not be feeling well and your sleep will start to break. And with that comes a whole cascade of problems.
Now, the reason why I contacted you about this was because quite a few people have sent me emails and messages, and they suggest that they're really battling to sleep during this time of lockdown, and they can't really put their finger on it, and they're not sure why, thinking they've got time, they can sleep, but they actually can't. What do you think could be the cause of that?
So the battling to sleep will often be because you have either extended sleep or you are quite unhappy or anxious. So anxiety has a huge knock-on effect on sleep. And it's not unusual then for sleep deprivation that accumulates over the days to then have the effect of actually causing a depressed mood. Depression is just a feeling, and people get completely freaked out if you tell them they may be depressed. So we try and steer clear of that, because it really is just this degradation of mood when you haven't been sleeping very well, which is well documented in research, and even your performance will go down. You just have that feeling of being absolutely off your game, and it becomes quite difficult to feel upbeat or get on with what you need to do because you're so sleep deprived. But the natural sense for people when they're battling to sleep is to try and sleep more, to give themselves more opportunity. So a typical narrative would be, oh my gosh, I didn't sleep last night. I think I'm actually just going to go back to bed and I'm going to go and try and catch up on the hours. So they do the catching up on the hours thing, and that is really a bad choice. That's where the first narratives in your head, in other words, your thoughts and the way you are actually priming your brain to think, starts to move into what we call the maladaptive system related to not sleeping.
Okay, but how does the lack of sleep affect us psychologically? How does it? What impact does it have on our psyche?
That's a very important question, Noel. I think that South Africans as a nation, and perhaps globally it's true as well, tend to be quite sleep deprived. So generally, we have started to wear, sleep deprivation like a badge of honor, and not really notice how much it does affect us. So the answer to your question about how does it affect us psychologically, quite a lot. So because we know that one of the first things to actually be affected is mood. So mood would be affected in a way like irritability. So irritability becomes a very common feeling that's worn, and sometimes consistently irritability, annoyance, frustration, and sometimes even escalating to anger. It's very, very common. And so with that in mind, people who normally manage their moods quite well might suddenly find that they are experiencing these feelings and really get quite distressed, that they might either lash out or be feeling constantly irritated, and sort of then feel that they want to remove themselves from others and not interact.
Okay, that's very... My ex-wife was one of those people that did not do well with the lack of sleep, and I know a lot of people that are like that. This week, they released crime stats, and most of the crime stats have gone down, but one that went up was gender-based violence. Do you think that lack of sleep and being in a confined place could actually add to the reason behind gender-based violence by any chance? Just throwing it out there.
So, Noel, this is a really, really important question that you've just asked, during this time. It's an important question at the best of times. So the whole concept of gender-based violence is very loaded and has many, many aspects to it. From the point of view of sleep, I would definitely say that it will exacerbate, as I said, mood. And so anybody who has a tendency, to be very volatile and need to be powerful over everybody else, and without being able to disempower other people and undermine them, will actually be made worse by the fact that they're either not sleeping enough, or they may be just sleeping too much, because too much sleep is also not good for you. You brought that up earlier, and often too much sleep will bring in a state of what we call sleep inertia, where you're really, really off your game and, not even thinking clearly. And we know from studies that your mental status, your cognitive state, how you're thinking is very sort of blurred and foggy. So, too much sleep, too little sleep, definitely going to impact on this aspect. And I think one of the things that will definitely influence it will be boredom. And so the opportunity to sort of wield power, to start undermining people verbally, or to feel that, there's something that they deserve or they need at the moment, and people are not willing to engage with it. And then, of course, the anger starts. So it is a bit of a minefield. And I think that, the fact that you asked that question is really great, because we've got to be very careful of this aspect at the moment in South Africa during this time.
Thank you, Michelle. Yeah. Now, here's the thing. Whenever anybody does an interview with me, there's always going to be an on-the-spot question. And I'm sorry to do this to you. I didn't warn you, but I'm going to put you on the spot now. Okay. I've known a few people in the past, and some people are still friends of mine, but they swear by the fact that marijuana, weed, helps them sleep. Now, you being a sleep specialist, your on-the-spot question is there any truth to this, or are they just smoking the wrong stuff?
My on-the-spot question is certainly quite loaded, Noel. Yeah, it certainly is something that I've experienced regularly, and I mean, even in sessions, that are not to do with sleep. And I'm always quite amused by the very important lectures that I get from the adolescent population around, marijuana and the use of it and how very good for you it is, etc., which is quite. It just makes me laugh. So from a sleep point of view, yes, I have experienced it quite a bit from people telling me that they've used it, and interestingly enough, most of the experiences have not been great, and that in fact many of them actually have talked about feelings of almost being paralyzed, that they actually have also been, during that time, felt quite frightened, have, had hallucinations, and I suppose it also depends on the type, and I've been also had these large lectures on, the pureness of it, and it must, have all these particular protocols followed in order for it to be the right and the most accurate amount. So I think my answer to the question is that in my experience, I've had honestly a very small portion of people who felt that it worked, and most of those people have been those that have actually got chronic illness. So chronic illness would be things like cancer or any of the neurological degenerative disorders. And again, it's few and far between, but the larger population have said to me that they've tried it and it did absolutely nothing for them. They really didn't find that it was useful for sleep at all. But you must remember that, of course, I obviously work with a clinical population of people who really are seeking help when they're quite desperate sometimes. It's unfortunate that many people come when they are desperate, opposed to rather, connecting with me quite early when they're battling with sleep. But, there might be a lot of people out there, that say it works really well for sleep, as you say, but in my experience, and certainly from some of the collaborative work that I've done, and, most of the sleep fraternity are not really promoting it at all. So, that's my on-the-spot question answered, I hope.
Well, thank you, Michelle, for joining us on Lockdown Radio and giving us insights into the importance of sleep during this period of lockdown. I look forward to having you on the show again in the near future to discuss some other impacting issues as well.
Absolutely, Noel. Thanks so much for the invitation. It's actually been really great to ponder over these things and, even reminding myself, to follow these as well, because I think as psychologists, we certainly have to practice what we preach and make sure that we are bringing the most important and up-to-date information to South Africans. And I also, at the moment, am, as I said earlier on, busy with this research on insomnia, and I really, really hope that it's going to have a nice impact on South Africans quite soon.
Well, that was clinical psychologist Michelle Baker talking to us about sleep during the lockdown period.
Hi, this is clinical psychologist Michelle Baker, and you are listening to Noel Johnson on Lockdown Radio.
Right, coming up just after this, the featured artist for the day, Donovan Seagreen in the house. Take us up to that. Vanilla Ice and Ice Ice Baby on Lockdown Radio.
And now, coming to you live in your bathroom, in your bedroom, in your lounge, in your kitchen, at home, it's Lockdown Radio.
Don't touch that dial.
Give me a beat.
That's funky.